Thank you, Pramod. That was unexpected, and I hope I was kept away from it. It was not planned. So anyway, it's so nice of you guys to do that, and good morning once again. For me, it's a great pleasure to be delivering this oration. Chairman, senior professors, thank you very much for being here. It's an honor to be among friends and great colleagues. This young organization has wonderful talent and fantastic camaraderie. There's no doubt about it. So in this fast-paced technological era and ever-changing values, there is a need for guidance for all of us. Just a little before, we had some very thoughtful, insightful, and futuristic talks by eminent speakers. So I thought I'd look at the other part and say, should we be in search of a guru? So who is actually a guru? So a guru is a dispeller of darkness. I'm not talking Baba Ramdev or not people like that, but in reality, a person who dispels dispels darkness is a guru. In Rig Veda was one of the fountainheads of Hindu culture. It was the one of the earliest known written books, 3,500 to 5,000 years BCE. And there was a shloka in that. I'm not a Sanskrit literature. I'll try to be as best as I can. Ano Badra Krutavo Yantu Vishwataha. It means let knowledge come to us from all directions. And remember, this was 5,000 years ago. The sages felt that our brains and our development should be such that we get stimulation from everybody. So what is the difference between a usual teacher and a guru? A teacher gives you things that you do not have and you require. A guru takes away things that you have and you do not require. And therefore, it's very important for us to have the capability to look for a guru. So in this, there's a very difficult concept unless you know who is a mentor and a mentee. So the mentee is the driver and the mentor is the co-pilot. So it helps both of them to reach the destination. It's not just giving directions. Both of them go together. So there must be certain qualities of a mentor you should think of. They must be respectable. They should be capable of listening. They should challenge and collaborate with the mentee. They should celebrate the success of the mentee. They should stand for truth. Safety and empathy must be a part of their thought process. And what are the qualities of a mentee? He or she should be coachable, should be an active listener. They should have a goal to which they go to the mentor for. They should be willing to take a critical feedback, respect mentor's time, and after their training, should be ready to move on in life. They should not be a parasite. And therefore, a healthy mentor-mentor relationship should be based on three important characteristics: truth, trust, and honesty. And remember, as we grow older and you have students, if you have these three things as your pillars, most likely you are likely to be a good mentor. And of course, you can have peer mentoring among youngsters, but there should be based on 5 C's. There should be a good connection, confidence. The characters of both should be impeccable, competence and compassion. Now, basically a mentor is a teacher. Guru is a super teacher. And where the teacher shows the way, Guru is the way. So, in the earlier days, centuries ago, there was this concept of Guru Shishya Parampara. It's an Indian word, Parampara. The translation is a tradition. So it's a very important tradition in India. It was even, it's persisting even in music today. There are 4 stages. Diksha means a formal initiation, whether the person is interested or not. Then there is a Shiksha, there is a transmission of knowledge. There is a Guru Dakshina, there is a gift to the Guru It would not be necessarily a gift of a big financial gold or silver. It can even be as simple as an offer of a fruit. And a Guru Gotra, the highest accolade that a Guru would get is when the student accepts the Guru's name as a surname. Now there were so many Guru Shishya pairs in our history. Dronacharya and Arjuna, we all know that. Chanakya, Chandragupta Maurya. Swami Vivekananda and Ramakrishna, it's a true love story. Acharya Veda Vikrama, who taught the art of war to Emperor Ashoka, and Buddha, who then showed the path to peace. And today, our god of cricket, Sachin Tendulkar, had a guru in Ramakant Achureka. And this has been scientifically studied. There have been enormous number of papers, as in this Journal of Applied Psychology, where the mentor functions and outcomes were discussed. And there were Cram's mental role theory, which says these are the characters of all the mentors, which was written thousands of years ago. So let me discuss a few mentors. So these great mentors did something wonderful to all of us, either directly or indirectly. So who mentored Madame Curie? Madame Curie, she had no mentor. She came from a very impoverished Polish landscape, studied in Sorbonne in Paris. She lived in very, very miserable conditions. In the cold of Paris, she would be shivering. But she was the first woman to receive a doctorate in sciences. She was the first woman to receive a Nobel Prize in physics in 1903. She married Pierre, who also got a Nobel Prize subsequently. She got a Nobel Prize second time in 1911. She mentored her daughter to such a way that she got a Nobel Prize. Her son-in-law got a Nobel Prize. This is the only unique family in the whole history of science that the family has 5 Nobel Prizes. When Marie Curie died, Albert Einstein, the greatest brain, scientific brain to have ever lived, said, Marie Curie is, of all celebrated beings, the only one whose fame has not been corrupted. Such was the strength and character of a beautiful mentor. And our own C.V. Raman from Bangalore, he made a discovery on 28th February 1928. It was announced from Central College, which is still present in Bangalore, jointly with Krishnan. This was a true Guru-Shishya relationship. Krishnan went on to become a great professor, published a lot of papers, became a director of a great institute. Now, Raman was the first person of color and the first Asian to receive the Nobel in 1930. It's called the Raman effect. So, why did I select Curie and Raman of all the hundreds and thousands of scientists? Both Curie and Raman received Nobel in physics and chemistry. Their application in medicine is extremely important because Curie's theory for radiation has helped shape lives of millions of patients. And Raman's research activity is in biomedical research, is in analytical studies and biotechnology. Their primary work in physics and chemistry has dealt a fantastic result in medicine. They were great mentors. Now let's just pause for a moment and look at the year 1967. In 1967, the Vietnam War was in progress. Anti-Vietnam War protests were gaining momentum in the United States. The Cold War was in full swing. East and West Germany were still divided. Hippie culture was in full force. The Summer of Love in San Francisco. Beatles released their new album, one of the famous Sgt. Pepper's Lonely Heart Club Band. I hope many of you listen to Beatles. China tested their first hydrogen bomb. Indira Gandhi had just become the Prime Minister of India after Lal Bahadur Shastri died. I mean, a phenomenal number of events happening. Che Guevara, the Argentinian communist who revolutionized the whole of South America, he just died. The race to land on the moon was on. Apollo 1 launch pad fire killed 3 astronauts. The Russian cosmonaut was killed the same year on re-entry to Earth. Hussein became the president, Zakir Hussain, president of India. He was the first Muslim to do so. A.R. Rahman was born. Madhuri Dixit, Juhi Chawla were born. They became iconic stars. The first arthroplasty device, can you believe? The first arthroplasty device in the world, the first arm ball, was reported just a year before. And a lot of actors, actresses, a lot of them got a first arm ball in their necks and backs. Harrington had reported a few years ago the metal rods. It became a big hit. Every other spine surgeon wanted to put it. But in that year, quietly and with a lot of exuberance, two major medical events happened. And I'm going to discuss those events. Christian Barnard from South Africa reported the first human transplant, beating the Americans. That was a shocker. And there's a guy called Mohammad Ghazi Azargil from Switzerland reported the first extracranial, intracranial bypass surgery. So let's discuss heart and why Christian Barnard faded and the reason why Michael DeBakey I'm discussing. Michael DeBakey has been described as the greatest surgeon who ever lived. He was a pioneer neurosurgeon. He was considered a renegade physician, supposed to be personally very arrogant to people. I personally know a doctor who was in the lift with him and he was asked to get out because the lift has to be only for DeBakey. He was the doctor to the presidents and the kings. He brought Denton Cooley from Boston to Baylor College of Medicine. He had more than 1,000 papers. He helped establish the National Library of Medicine, the world's largest and the most prestigious repository of medical archives. We all use it today. He formed the Veterans Administration Hospital. He was honored with many, many medals, the highest of medals. Michael DeBakey was extremely demanding. He shattered the nerve of his residents. He had a great nose for talent, but he failed to nurture. He was so horrible that Denton Cooley quit working for him and started the Texas Heart Institute in 1962. There was a famous rivalry between DeBakey, Cooley, and Barnard, but Barnard won the race for the first human cardiac transplant, leaving the American surgeons with red faces. But no matter, DeBakey left a legacy. He was a great mentor, bad manners, but great teacher, great guru. So I think you should understand that why we call Michael DeBakey a cardiac guru. Let's move on to Ghazi Azargil. He is living today. He's a living legend. He was the father of modern microneurosurgery. He was the neurosurgeon of the century, 50 to 99, because Harvey Cushing was given the other half. He was the greatest neurosurgeon of the modern era. See, he was born in a small village called Lis. Lis, remember the word Lis, in eastern Turkey. He studied in Ankara University. Because of knowledge, he went to Germany, Friedrich Schiller University in Jena in 1944. Because of World War, he moved to Basel in Switzerland. Became a doctor in 1950, became influenced with a neurosurgeon in 1953 at the University of Zurich called Professor Krehenbuhl. He then became a resident professor and remained a chairman. Now, Professor Hugo Krehenbuhl was a man who was very strict, very arrogant, like many Germans, and was a professor and chairman at Zurich at the time. He was considered the father of Swiss neurosurgery. Now, he started the first dedicated neurosurgery unit in Switzerland, and he accepted Azargil into the program. There is a story that Azargil operated on a patient when Krehenbuhl was not there. And Krehenbuhl came back, he got so upset and he relegated Azargil not to come to the operating room for 3 to 6 months. So during this period, there's a lot of changes happening in Azargil's mind. But let's go back to Azargil again. He developed the first telescoping screw for a transthoracic approach in 1960. And that became a future cage. Between 58 and 65, he did 800 stereotactic operations. Can you imagine that? In 8 years, 800 operations in 1950s. In 1963, when the Zeiss company gave them a first ophthalmic microscope, he became interested in it and started balancing option to that, added lighting, video, and still photography. All of that we are using even today. So what happened was, when Cranbrook got upset and threw him, he finally relented, and Muhammad Ghazi Azargil said, I want to learn microneurosurgery. He was sent to University of Vermont. He finished exercises in 6 weeks, which was supposed to be done in 3 months. That was his passion. He included, this included opening, patching, closing all arteries, which were very minute, 0.5 mm. And in 67, the year that we are discussing, he performed the first STA-MCA bypass. Now, Gazargil is considered for his great work in brain tumors because of his deep and thoughtful study of the subarachnoid spaces. He used those spaces in the brain to attack brain tumors, aneurysms, AVMs. He performed over 7,500 intracranial operations personally. Nowadays, we have surgeons who say they did 60,000 operations, 50,000 operations. These are all personal operations, recorded, maintained. They were all videoed. Every single operation has a video. Can you believe it? It is archived. After retirement from Zurich in 93, he took an appointment as a professor in Little Rock, Arkansas, and he has trained over 3,000 neurosurgeons. I think all of us as neurosurgeons, or any micro neurosurgeon, owe a tremendous debt to this great pioneer. So the village of Lees is famous for 2 things. Birthplace of Yazargil, and of course it was a site of a great earthquake. We do not have incontrovertible evidence as to what was cause and what was effect. Ghazi Yazargil is a neurosurgery guru. So now we had an age where we had Guru Shishya Parampara, and we had great minds like the Debekis, we had great minds of Yazargils. Now it is the digital age where we have virtual gurus. We have digital age, CT scan, MRI, Google, YouTube, Vimeo, Zoom, HoloLens, 3D printing. As Professor Raja was mentioning, AI, ML, robotics. Today are the bywords of learning processes today. So if you want to have something to be simplified, you want to see and learn how a new procedure has to be done, very simple. Click a button, search Google for relevant papers, see YouTube for technical aspects, talk to peers and experts on Zoom, practice on a 3D model, plan on a laptop with AI ML built in, use a HoloLens for surface planning in the OR, ask a robot for the surgery. I mean, this is what everybody is talking about. So these digital gurus will guide the physician through the process. The virtual guru will guide the treatment plan. Perhaps he will warn when less than appropriate procedure is planned, suggest alternative plans, and will halt when not indicated. And that's going to be a reality. So we have over several centuries, the Guru Shishya Parampara, we have the Curies, Ramans, Debekis, we have the virtual guru. What next? Are we done? I think this was a very thoughtful insight by Atul Gawande in 1911 issue. Top athletes and singers have coaches. Should you? So, do we need a coach in the operating room? That's something we have to start looking about it. Think about how to evolve from now on. Think about creating a digital universe around the patient. It's going to be called Digiverse. So the Digiverse is what's going to happen around the patient. And then you have to have everything around the patient. AI, ML, robotics, etc. So I will leave you with those thoughts. When Swami Vivekananda said this, self-confidence is the means for creating all wealth. Self-confidence is the source of happiness. Self-confidence is at all times the driver of good deeds. Thank you for your attention.